Okay, I'm just trying to decide, is bloodletting good for me? I mean, the way my heart feels, it could be a high blood pressure. And if I donated blood, maybe I could get some relief. Maybe if it drops my blood pressure down, that'll calm things down and smooth everything out. I've been looking at it, and it makes me question further a lot of the practices. I was just getting some facts about donating blood, and it's like, your blood may not even go to the a patient. It said one of the facts was 1 in 20 of the bags go to waste. They go in the drain. So it's like, what's the sense? You get a free medical checkup, I guess. Apparently, that's maybe worth $200. You get a free medical checkup that's worth $200 because they can the Red Cross can sell your blood for $200. That's to pay for all their stuff, so the equipment and then the free checkup. I guess that'll run like $200 on average. But I wonder, that seems like it's the most acceptable way to give blood. But in the 1700s in America, and before that too, because with Chinese acupuncture, they were bloodletting and collecting it in bowls or whatnot, measuring the amount. They used different practices, and this was at a time they didn't know much about disease theory and stuff, so it seems like they threw this bloodletting out the window, and they threw out bloodletting and everything associated with all of that by the early 1900s, when they understood they could look through a microscope and look at disease and make some kind of cure for the disease, and also just keep it cleanliness and stuff, killing bacteria and pathogens and all that. They found that bloodletting really isn't that effective in taking care of a bacterial infection, so they threw all that out the window. But there are people talking about the health benefits of donating blood, but they're not talking about getting rid of disease. They're talking about iron issues. If you got too much iron, it can become toxic, and it causes free radicals, which could lead to cancer. So you keep your iron levels in check by donating your blood. But I think magnet therapy does I got like this stick of magnets. Well, I prefer using this one. I just use magnets to control my iron levels. The ions, the calcium ions, even having too much. If you drink a lot of hard water, even that's got a lot of calcium buildup, that could lead to heart issues. I don't know if I want to worry about iron levels, 'cause I think magnet therapy can help with that. I think it can that can control the iron levels, but that's the argument for the health benefits. But then if you go further, if you look beyond donating blood and into bloodletting, you got to look for these topics separately. They just don't tie together. People don't tie them together. It's the same thing to me. There's a video in India, a guy talked about how his arthritis feels better. He feels more mobile with the cuts. There's a crude measure of cutting. You see 5 or 6 cuts around a person's ankle and they're bleeding out. And the Indian practitioner charges them money to do that. It's a part of their bloodletting, relieving the blood. I read about Andrew Jackson, our old president Andrew Jackson from the 1830s, 1820s. He used to purge himself. He used to bloodlet to help with his health issues, and he lived to 77 with a bullet lodged next to his heart. He was the last president who had participated in a duel and got shot and survived it. Then you got cutters, which is really sad. There's teenagers who are out there cutting themselves, and what thrill do they get? They get, part of that is the bloodletting part. They're completely undisciplined. They don't know where to cut. They do it out of emotion from mental issues. These people need to be trained better if they want to participate in bloodletting, in relieving blood. Maybe they could look into giving blood at the Red Cross. But once again, it's, do you agree with the medical profession? Poor people can't even afford the hospitals. I don't go. I can't afford it. Why should I give blood? Why should I contribute to this inflated medical industry by giving blood? I'm kind of interested in doing some bloodletting. See if that maybe can drop blood pressure, help relieve my issues in my heart. But the magnet therapy's helping a little bit, but I'd be curious about trying other things. But I got a conscience too. I can't get into hospitals because of the cost. But I honestly, I'd prefer to go to an acupuncturist before a hospital, and I can afford an acupuncturist seemingly even less, unless that was next to a college for acupuncture where the students put the therapy into practice. They charge a lot less. I was paying $20 per acupuncture session. In fact, in San Diego there was free. I don't know, they had to pay for their needles and stuff, but that was for the students. It was free treatment for the homeless, and that was the first time I got into that. I didn't, I did lose a little bit of blood at one time when they put a needle between my eyes. A little bit of blood came out. Well, when a girl pulled the needle out, a little blood came out. So there's a little penetration with that. Acupuncture does use bloodletting. That's a part of their treatment. They still do it. It's been in practice for years. So it's got a lot of positive results. But Western medicine, they have to be able to profit from it by being able to sell those bags of blood and claim that it's going towards people who need it. But then on the other hand, what about drinking blood? I mean, if they're curing certain issues with bloodletting, what about blood consumption? I mean, yes, okay, somebody cuts themselves and they're bleeding all over, they need a bag of blood for that. But what about drinking it? What about for health problems that maybe you're in a deficiency? Some people find relief with dumping some blood. But there's also an alternate universe with health, where there's some people that get some relief by consumption of it too. There's a lot around it, and I feel cringy talking about blood, so it's a touchy subject.